Public health investigators across the U.S. are struggling to keep up with new COVID-19 infections. States downsized their contact tracing teams earlier this year when virus numbers appeared to be dropping. Well, now, with cases of the Delta variant stacking up, they're being stretched thin, and it's forcing some government and health leaders to make some tough decisions on what to prioritize. Amanda Michelle Gomez has been following this story. She's a reporter for Kaiser Health News. Amanda, thank you so much for joining us. So I sort of remember at the beginning of the pandemic when we were talking about sort of the three pegs of, tackling this pandemic: mask wearing, social distancing. Contact tracing was one of those pegs, but we weren't very good at it in this country. They seem to be better in other countries. I get the impression that we got better at it, but then things have fallen apart. Just how much have efforts to contact trace scaled down in recent months, and how is that making investigators' jobs harder as the Delta variant remains on the rise? And I also do recall, people were not actually all that open to the contact tracing investigators. They didn't always pick up the phone or answer their questions, and so I'm wondering if that's also a problem.
Sure. So thanks for having me first. And you're right, a lot of states in the country have scaled back contact tracing efforts. Johns Hopkins says at least 12 states have significantly scaled back their workforce. We have to remember that a lot of these contact tracers were temporary staff. Health departments at the start of the pandemic, when contact tracing in conjunction with testing and other social distancing and other mitigation efforts, when they work in conjunction, was said to be how to slow the spread of the coronavirus. And so health departments hired in loads. They had some semblance of a workforce, but it was, people who were laid off in the pandemic and then hired as temporary staff, right? Or they were from folks outside of the health department, other government officials who were asked to join the force. And then when COVID cases declined in the spring and summer months, as vaccination efforts took off, then those workers went to their old jobs, or there was just not a lot of work for those workers in some cases. And so in other cases, like you said, health departments, depending on their experience with contact tracing, they also just didn't see the point in keeping such a robust program up. So, the reasons vary depending on the state, of course, or the city. San Francisco, for example, was a city that in part says contact tracing there in the city, and because the residents were willing to pick up the phone when a contact tracer called, that it helped keep cases down. But in other parts of the country, there was more resistance of picking up the phone and cooperating with the medical advice that contact tracers provided, like quarantining and such. So depending on a state's or city's experience, they decided whether or not it was a good time to scale back, or by how much, right?
So what factors are causing local health and government leaders to shift their priorities away from contact tracing?
Sure. So, like I said, in part, their experience earlier in the pandemic is the reason why they're deciding to scale back or not. Another part of it is, we're COVID fatigue, right? This has now entered the lexicon. We're just kind of tired of dealing with this. And by we, I mean like the everyday person. So if someone is calling, if the health department is calling, some public health officials have told me that, they're less inclined to pick up the phone, or at the very least heed their medical advice. And also, there is some, politics is at play. We're seeing it with masking. We're also seeing it with contact tracing. In Texas, for example, the Texas legislator has basically defunded the statewide contact tracing program. So now the Texas Health Department is completely winding down. In fact, today is the first day it's no longer is because it's now no longer adding any more resources to COVID contact tracing, and the Texas legislator has not been so supportive of the contact tracing program already. For example, in August, 5 of the more conservative lawmakers there had sued Governor Greg Abbott and the Texas Health Department for facilitating a contact tracing contract.
So, I mean, what are health experts telling you about the impact of just shutting down or defunding these contact tracing operations, especially when we're in the midst of another surge?
Yeah, absolutely. So I spoke to, like in Texas, for example, I spoke to the lead epidemiologist at the Wilco Health Department, and she was nervous. She didn't know what that would mean because their health department entirely leans on the Texas health department for contact tracing resources. And while some cities and states thought that it was would describe the contact tracing efforts as not as, it wasn't the panacea, right? I mean, we didn't entirely contain the coronavirus. No one I spoke to advocated for abandoning contact tracing altogether. Many emphasized when deployed strategically that it could be very helpful. Another example of how contact tracing in recent weeks has been helpful was in Provincetown, Massachusetts. Contact tracing efforts there helped the state and thus the country better understand how Delta works in vaccinated people, right? I mean, contact tracing there basically helped us, and it helped inform the mask guidelines now that the CDC had issued, right, about masking indoors. So again, no one that I spoke with, at least, is okay with completely abandoning the efforts, but they are also empathetic to public health departments who are historically underfunded and under-resourced. You have to be strategic, right? So some of those resources are going towards vaccination, and vaccination needs to be the priority, so they can understand making these tough calls.
So let's talk about one of your colleagues at KHN News, who's written that state governments are pulling back on posting updates on information like cases, deaths, and hospitalizations. So without state governments to provide this info, how difficult is it to access this data otherwise? And I guess the important question is, what implications does that have?
Absolutely. I mean, it's tough to make decisions when you don't know what's happening, right? So having information about COVID cases, for example, in Florida, where COVID is very politicized there with masks and with data. They're only publishing once a week. And I actually spoke with the Broward mayor who has been trying to get more information about not only cases, but contact tracing data. Like, he has no idea how many contact tracers there are in his state or his in Broward. And it prevents him from completely understanding the coronavirus in his own area, right? And he, though, is hesitant to push for this information. He told me, he's not trying to make martyrs of public health officials, which we have seen just nationally, right? Public health officials, expressing, sometimes they've come under immense scrutiny with legislators, with lawmakers in their own states.
All right, Amanda Michelle Gomez, thank you so much.
Thank you for having me.